Good afternoon, everybody. As we all know that ultrasound modality have no side effects or no bio effect. There's some precautions that there can be a bio effect, but in general, nothing reported that which says that ultrasound harms somebody. No, it's not reported yet, but just to be on the safe side, like for example we said if our mechanical index increase more than 2 degree, so that index if it's more than 2 it can cause some kind of bio effects. It can cause some thermal index will go higher with that. So our mechanical index has to be less than 1.5. Most of the doctors they really recommend or the radiologists they recommend it has to be less than 1. That's like more safest area. But anyway, we have two knobs from the knobology, from the ultrasound physics knobology. We have two knobs. One, it's called mechanical index, and the other one it's called 2D again. Now, both of them are used to make the picture either brighter or make it darker. So we all know to make our picture more diagnostic, to make the picture more optimized, we need our picture to have a proper brightness. So sometimes we use a knob to make the picture brighter, or we sometimes we need to make the picture a little darker just for better image quality or to have more easy diagnosis or a perfect diagnosis purposes. So let's make it shorter. So these two knobs, mechanical index and 2D again. Now when, where to use which one? Should I use the mechanical index first or should I use the 2D again first? Which one is more safer, more on the safe side from the bioeffects? So we all know if you play with a mechanical index, so it means you are increasing or decreasing the power from the transmission mode. When the sound is sending, the transducer or probe is sending pulses to the human or animal body. So the pulses are going to the tissue inside. Now, this is important. Now you have to pay attention if you play with the mechanical index button. So you are actually either increasing the power of the transmission mode of the pulses or you are decreasing that. When you play with the 2D gain, make it increase or decrease. So actually you are playing with the reflectant echoes. When the reflection coming back from the echoes, the sound is in transmission mode and then the hit anatomy or any of the structure and they reflect back. So that reflection is actually the 2D gain. Some people call it receiver gain, some people call it overall gain, same thing. So now conclusion is, if your picture is very bright, my advice as an ultrasound specialist is, if your picture is very brighter, make sure to decrease the brightness with the mechanical index first. Adjust your picture, make it darker to the point you want it because it's too bright. So use the mechanical index first, decrease that mechanical index first. Now if your picture is really dark and you just wanted to make it a little bit brighter, the overall picture, the entire picture, you want to make it a little brighter, so my advice is, first of all, use the option of 2D gain. 2D gain, overall gain, receiver gain. Make sure to use that option first. Make it increase your 2D gain to make your picture brighter. If it not work for any reason, your second option is then you can use your mechanical index to make the picture brighter. But the first option is to use the 2D gain first. So that will be on the safe side. We try to have a good diagnostic optimized picture with no harm to the patient. So in a darkening, when you want to make your picture darker, once again, if you want to make your entire picture, make it a little bit darker because it's too bright, use the option A, the first option, which is mechanical index. Decrease that first. And now if you want to make your picture brighter because it's too dark, so option A in this case is, or the first option is, to use the 2D gain first. Increase it. If it's not working, then you can use the option B, which is the mechanical index. So I hope that helped you guys. Try your best. Find it. Most of the machine you will see the mechanical index. It's in either you can see it on the screen or you can see it on your keyboard. It's mostly like in Sequoia Acusen machine. You will find it on the left corner, on the top left corner on the keyboard. It's a small, you can see there's a small glass and it's written there, where is your